And by doing that, it reduces that time, it reduces, those steps and just kind of streamlines it. And we see that, number one, it's employee satisfaction. They like it because it's not so chaotic, and it's a little, it's a little bit clearer on what needs to be done. And we find that they tend to be more compliant with it as well. Once you make it a little bit easier, a little bit streamlined for them to do what they need to do, you'll see that the case cart completion and accuracy will go up.
Rising above the buzz of ultrasonic cleaners and the clanking of stainless steel are the ideas and voices that are changing an industry. You're listening to the Beyond Clean podcast, the central nexus for the people, processes, and products that are improving our sterile processing world. Each week, we speak with frontline technicians, CEOs, engineers, and entrepreneurs with a common goal: to help you fight dirty, every instrument, every time. Whether you're tuning in for education or inspiration, we're glad you did. Now turn on those washers and turn up the volume. It's time to go beyond clean.
What's going on, Clean Freaks? Welcome back to another episode of the Beyond Clean podcast. You're listening to Season 30, Tray Command, where we look at tray logistics, instrument logistics, where they go after they go into that sterilizer. I'm your host for the season, Bobby Parker, and joining me for the full season of Season 30 is Angela Benson. I probably don't need to keep saying that, Angela. I think everybody's got that figured out at this point, but either way, welcome back to the studio. It's been a lot of fun this season getting to talk with you about SPD topics and tray logistics.
It sure has, and it's given me a lot of opportunities to continue talking, as I always do, with my coworkers and around work. I love being able to kind of keep my work going everywhere, since everyone knows how passionate I am about sterile processing.
I'm just chuckling behind the microphone over here for those of you who haven't gotten to listen to some of the off-recording conversations we've had of Angela saying her coworkers give her grief for always having something to say, which is part of the spirit why she's joining us for the season this season. Today, the thing that we've got a lot to say about is case carts. Now, we talked emergency carts, we've talked storage locations, we've on previous seasons even talked about, what kind of case carts ought to be used, whether you should lock them or keep them unlocked, all those kinds of conversations. But today we're going to get into a little bit of the messy relationship sometimes that happens around case carts as to who pulls them. Is it SPD? Is it the OR? Is it supply chain? Is it all of the above? And then also, how does it get done? Preference cards. Are you zigzagging all over the place, pulling things you don't need or pulling things from 5 different locations? And we're bringing in a guest to help us cleanly through all of that mess, because I don't know about you, Angela, but most of the facilities that I've been in and go to, case carts are a big headache and full of, everybody admits it's inefficient, but nobody knows what to do about it.
No, and there's countless projects you intend to do or try to get buy-in from OR. I mean, for our facility, we pick our cases right out of SPD, and it's very vital to have that input from their staff as well, so we can be more efficient.
Well, I think we've got the right team to be talking to on the call today around case cart efficiency. It's kind of what they do for a living from a consulting perspective. So I'm eager to see what Courtney's going to have to share with us around principles about how to make an efficient case cart process that not only you can be proud of, but also is going to buy you some time to do other things that your department certainly needs to be doing, like, I don't know, inspecting and sterilizing instruments, and also keeping that patient safe, because it really can cause problems when the OR doesn't have what the case card says or what the preference card says they need to have in that room. So excited to be digging into this one. We'll be right back with Courtney Kleeb after a short break.
From the studios of Healthcare HQ, you're listening to Beyond Clean, the global voice of sterile processing.
Joining us now in studio is Courtney Kleeb, Senior Director of Perioperative Surgical Solutions at HealthTrust. Courtney, we're so happy that you joined us to share some of your expertise with us on the show. Welcome to the podcast.
Thanks. I'm glad to be here. Thanks for having me.
Yeah, absolutely. Now, Courtney, we got introduced in the industry around a project that had everything to do with case carts. And so I'm really eager to dig into this topic and hear a little bit more about what your team does to try to help with case cart solutions and workflows in particular. But before we do that, would you mind to introduce yourself for the audience? Tell us a little bit about yourself and what you've been doing in the industry.
Yeah, absolutely. As you mentioned, or as your great introduction was, I'm Courtney Kleeb, Senior Director of Perioperative Surgical Solutions for HealthTrust, which is a GPO. I am clinical by background. I have worked for a long time, over 20 years at this point, in the healthcare industry. And I started off as a scrub tech and went back to nursing school. And when I finished nursing school, went back into the operating room and have worked various roles, worked myself into leadership and in various facilities from, academic level 1 big facilities to regional facilities and even for-profit hospitals as well, before joining HealthTrust, and where I help our members with finding real-world solutions and initiatives for any of their needs or wants in the perioperative space. So it could be anything from supply chain optimization, case cards, preference card optimization, to looking at things such as utilization, block scheduling, and sterile processing things as well. So, yeah.
Yeah, I think it's so cool what you guys do. So I want to underline that one more time, just in case anybody missed it in the whir of acronyms. So you mentioned HealthTrust being a GPO, right? And so I'm gonna take my best swing at the definition, and you can clean up the mess. So GPO is a group purchasing organization, and so HealthTrust has members that collaborate together as part of this group purchasing organization to secure maybe better pricing or better agreements on purchasing supplies or instruments or services for their hospital. So everybody's got their Sam's Warehouse shopping card that says HealthTrust on it. And so Courtney's team provides a service to those HealthTrust GPO members to help them not only from a supplies perspective, which is what you tend to think of from a GPO, but also a process perspective. How can we help make your facility manage your supplies more effectively? So that's my swing of the bat. You can clean up the mess now.
So I think that sounds absolutely perfect. Yeah, we are a service. We like to help our members in our GPO. We are a group of operators. My team, we have worked in the healthcare industry. We've been in hospitals. We've had to execute projects, things like that. So we like to take those real world solutions, things that we know that work well, and tailor it to the individual facilities to make them successful in whatever their initiatives are, whatever it is that they need us to help them with. And, I love it because you go in and you can see a lot of progress. You can see a lot of good things that happen. I love to see where someone starts, kind of what their journey is, and just kind of what the completion of that product looks for. And it's a great place to be, right? Because we get to see good things happen, and people really benefit for it at the back end, not only at the facility level, but, for the patient's care and safety as well.
Well, I know that you're the right person to be talking to then about case cart workflows. You talked about finding models of things that that work and then apply it to a specific facility. I can't think of a complex interwoven process in sterile processing that has more waste in it than the case cart pulling process, right? Between who's going to pick the instruments and the supplies, how they're organized on the pick list, how many supplies expire on the shelf, like the whole thing. There's so much waste built into that. And so to the degree that we're able in the next 20 minutes, I'd like to try to unearth some of those things about case cart processes that we know that work. So why don't we start right there? Whenever you go into a facility and you're evaluating case cart processes, what is it that you're looking for? Like what is a successful case cart process, and how does that look to you?
Right. I think probably one of the biggest things, the first thing that we're looking for is completion in that case card, right? Because isn't that the goal, that it needs to be complete? You want it that when your clinicians, your OR team, when they are going to get those supplies or get that case card, they're getting ready, to use on a patient. So you want it to be 100% complete, or as close to 100% as you can make it. You don't want them running in between cases, going to get stuff that's listed or that's supposed to be on that preference card or supposed to be part of that case card. That really kind of, it's inefficient, and it kind of makes that white space, in between cases or even before the start of the day get bigger, right? And you don't want that to happen. We also see, it can even go a little bit further. And when your clinicians are looking or getting those supplies, they find something that's missing, and it could be very clinically necessary. And then you're either delaying, rescheduling, or even canceling cases. And you definitely don't want that either. So that's probably the biggest thing. And then even when they get into the room, when that patient gets into the room, you don't want them going out of that room getting supplies as well. That patient's in there, you want your OR team within those four walls. You don't want that case time to last any longer. You don't want your patient under anesthesia any longer than absolutely necessary. You want them, when that patient rolls in, at the bedside providing patient care. So I would say that's probably number one, the first thing that we're looking at. Number two would be accuracy for it. The stuff that is listed and that is actually pulled is what's supposed to be pulled, not what someone thinks something is. And, for the same reasons as I mentioned before, you don't want to create those lengthy times or extend, that empty space between. And then probably the last one that we really look at is a very standardized, very efficient process, right? How you pick your case today is the process that you pick tomorrow, that's going to happen the next day, and so forth. So it kind of becomes routine, and people understand what their roles and the goals of it are going to be. And efficiently wise, that you're not, if you're picking a case and it's supposed to be maybe take 10 to 15 minutes, that it's not taking 30, 45 minutes or an hour, right? That you're not putting in more resources and more steps than are absolutely necessary to make it complete.
Sure. So the first two of those points that you said sounded an awful lot like preference card cleanup, right? Making sure that the things that are actually needed are going to be on there. And then whenever there's a unique need that wasn't anticipated by that preference card, having some process to get that instrument into the OR without them having to scramble out of the room and take time away from their clinical work in the room. And gosh, I hesitate to ask, because I know we could spend the entire time talking about like, what does a process look like for preference card cleanup? But any high level punch list items you want to recommend for people who know already before having Courtney come look at their facility that their preference cards are just a disaster?
Yeah. We see it a lot. We have a lot of people who ask us to come in, and I think that a lot of it, probably one of the big things is that if you want to undergo it, you want to revamp, you want to make your preference cards better. I think the first thing is to make sure, number one, that you've got the buy-in and the right people sitting at that table. Right. That we frequently go in and we see that, or a lot of the feedback we get is, hey, we were supposed to be working on preference cards and nothing happened. So, we just kind of stopped looking at them. Right. So you have to have that buy-in, and then you have to have that team and create those goals. Okay. So now we have a team together. Who's on the team? You want to make sure that you don't have just OR people on there. We think it's very good, and we see it be very successful when sterile processing is part of it as well. When someone from supply chain is there, I think we probably at this point, definitely since COVID, are all very familiar with, back orders and substitutions and conversions. And having someone at those meetings at the table from supply chain, at that point, they can say, hey, look, sponges with the number 1, 2, or 1, 2, 3 are going on back order on this date, the clinically approved substitution, which is now number 4, 5, and 6, will be in here. Well, now you can give that information to the people who can put it on the preference cards, make a local substitution, and then minimize the disruptions on the back end, right? Where someone can't find the product that's listed because it's been substituted, or they just don't put it on the case card altogether, right? I think number one, like, that's very important. And then creating those goals. What is it that you want to do with your preference cards? Do we want to do a purge? Do we want to make sure all of our nomenclature is the same? Is our format the same? And then that way you can create those processes to get to those goals. If it's just kind of like, I don't want to say super specific, but if it's just kind of a blanket statement, hey, here's a team, we're going to work on preference cards, and nobody knows what they're working toward, then nobody really has a vision in mind of what, kind of where you are and where you want to be. And I would say the biggest one is after you kind of do that data, you pull that data and you look at it and you make those changes, you add items, you remove items, you combine preference cards or create new ones, whatever that looks like. I see the biggest mistake that facilities make is that they don't create a long-term maintenance guide or tracking with it. They'll come in and they'll do these big projects, and then it just kind of falls off on the wayside. And then a year later, they're calling us again saying, hey, look, 15 months later, however long, hey, look, we've kind of fallen off a little bit. We need to revamp this and kind of start this over. So ensuring that you've got very clear expectations about, hey, we're going to touch preference cards every card needs to be touched, at least once or twice a year, however that looks. If it hasn't been attached and pulled for a case in, 12, 15 months, do we even need that card whatsoever? Always run, and technology and supplies change all the time too, right? I mean, we know that, there's new stuff being created all the time. So you always are going to have to look at those cards to make sure they're updated with, how your procedures change, how your physicians change, things like that.
And speaking with, we're asking about successful processes, what it looks like. And I think you kind of already touched a little bit on what's inefficient with that by just saying what you're looking for success. What is like your most common inefficiency through all of this that you've seen?
In terms of case cards or preference cards?
Case cards. So like the process, like who's doing it, what department, or, things like that just really keep popping up. That's very inefficient with that case card pulling process.
Yeah. I think probably the first thing, and Bobby kind of alluded to this at the beginning, probably the biggest inefficiency that we really see is that there's 3, 4, sometimes 5 different departments that touch a specific portion of those case cards and are responsible for it. And we find it to be very hard. Number one, the coordination is just difficult, right? If I'm the first person that's pulling it, and I get done and I'm like, okay, Bobby, it's 9:33 a.m. Now it's your turn to, pull your part, and then don't forget to give it to Angela when you're done to finish that. And so there's, number one, there's no closure, there's no loop on that. You don't know, if it's been done or how it is done. And then the communication just kind of, doesn't happen there, coordination as well. So then, it's difficult to, what we see is that it kind of just it just becomes incomplete because nobody's really owning that process. And since it's not under, one umbrella, it's really hard to kind of take that process and even PI it on the back end, right? It's hard to say, okay, what's working well, what's not working well, what can we do to make it better? So that's probably the biggest one that we see. And then number 2 is actually probably stocking inventory locations and them being very inefficient. And what that does is really kind of create a very chaotic and inefficient pick path, right? Where you're starting, where we see where they're starting, on aisle, A, and then they have to then go to aisle D and E, and then they have to run over to, core 4, which is, across the hall, and then they make their way back. Where what you're really wanting to look at is take your items and your high pick items, things that you're going to be pulling a lot, and kind of put it in that square from like your eye level to your waist. That way it's kind of, organized together and you pick, here, and then things that you aren't touching a whole lot or don't get picked a whole lot, you can put them on the higher shelves or, on the bottom shelves. And by doing that, it reduces that time, it reduces, those steps and just kind of streamlines it. And we see that number one, it's employee satisfaction. They like it because it's not so chaotic and it's a little, it's a little bit clearer on what needs to be done. And we find that they tend to be more compliant with it as well. Once you make it a little bit easier, a little bit streamlined for them to do what they need to do, you'll see that the case cart completion and accuracy will go up.
It's not a cheap process, fixing these workflows for sure. I mean, when you're talking about, consolidating storage and rearranging storage. In some cases, if we've got half of our instruments up in the OR and half of them in sterile processing and we're traveling with case carts in between to pick, finding a space and maybe even renovating a space to have a centralized storage where picking can happen more naturally. Certainly not a cheap endeavor. One of the things that struck me in previous conversations that I've had with your team is some of the dollar valuations that have been put on these projects of after the process is fixed, it's flowing smoothly. We're not having expired products. Surgeries are happening on time. We can pick them more efficiently. The numbers that we're saving facilities in the long term, just operationally on labor and on supplies, it's pretty staggering. Do you mind to give us kind of a picture, an idea of like what the opportunity is, like going through all the trouble of cleaning up these case cart processes? Like how much might an organization save by going through all the trouble?
It's hard to kind of put like a blanket statement on what that looks like. I think that it's hard sometimes for facilities to really kind of understand it because it's not a concrete thing to begin with, right? Like if you're looking at buying, stainless steel or storage carts, that's very concrete. Oh, here's this cart. It costs, $20,000. Oh my gosh, that's a lot. But then, because we're asking on the back end, hey, we're changing processes. We are, evaluating your time. We're evaluating the resources. We are trying to, get that down. And then it's hard to see because it's not just a very concrete number, black and white on that end as well. But with that, we do see by labor, by resources that are implemented in there. And and I'll give a good example. When we go in especially with case cart processes and picking, a lot of the times what we see are the clinicians are the ones that are picking the entirety of it, or they pick a majority of it, right? And right, wrong, or indifferent, the clinicians are the only ones that can be in the operating room with those patients, right? And that's ultimately the goal, right? Take care of your patients, get the patients in the OR, let's do those cases. And investing in creating better pick pads, storage, things like that decrease that and or remove that burden from the clinical staff allows them to get into the OR room, right? Because ultimately, like I said, they're the only group that can be in the room. They're the only ones that are going to get that patient back, the only ones that are going to be in there with that surgeon that are going to get, through the cases that are booked for the day. And, with doing that, you meet those time goals a little bit better too, right? Turnover time is lower in, first case on time starts get a little bit better. You get more cases on the books.
Yeah, for sure. We've talked a little bit about that top of license operating for folks, making sure our nurses are doing nursing, that kind of thing throughout the season. So I'm definitely tracking with you there. So having an efficient process matters. Having preference cards that are accurate matters, that our pulling team is pulling what's on the preference card matters. One of the other pain points that I've experienced just in my own case cart process journey at a former facility is not just do we have everything that we need, but do we have too much stuff on the case cart, like dealing with the waste in returns. And I don't know. I've been puzzled about this for a long time because some returns are good and necessary because we want to be prepared. Do you have a standard that you look at when you look at how many sterile returns are coming back and say, okay, that's too much and we need to fix that, or, oh, that looks normal?
Right. No, we don't necessarily have like a one and done for all. It's different for each facility that we do go look at. And to give an example, what we see or the expectations, let me say that would be, let's say we're at a level 1 academic facility that has 40 ORs and is doing the latest and greatest. If you can think it can be done, they're doing it. They've got all these robots, things like that. Actually, I had oversight of a place that it was like that. And then I also, in the same facility, we had an ambulatory surgery center that, had 6 ORs, off site, but they really kind of specialized only in like scopes, shoulder scopes, knee scopes, maybe some small ENT cases and things like that. But they were a little bit more, what I would consider a little bit more solidified, a little bit more routine, right, at that ASC. My expectations of what the returns that I see coming back from them would be much different than what I would expect to see, let's say, on a 2-panel, 2-physician case in a big inpatient operating room where, there's probably a little bit more that can go unexpectedly during that case, versus others as well. But with that being said, it's important, no matter what the facility is and what you're doing, to know that that is something to look at and then to PI that on the back end, right? To go in and say, okay, let's take a look at these cases. What is consistently coming back, whether it's soft supplies or instrumentation, and say, what's the need for it? Is there a clinical need for this? Or is it, and we have found this, that sometimes they will put these supplies on preference cards, and it's because the inventory location for it is way across the operating room, and it's too far and it's not feasible for them to be gone that long to go and get it. So they'll add this stuff to the preference cards just so that they can get it appropriately. And so that's the stuff that needs to be looked at and PI'd and worked on from there. Okay, if it's across the OR, do we need to change that inventory location for that, so that the clinicians can get it? Is it something feasible that, hey, if the need arises, if it's right outside the door, then yeah, that they can go get it, or whatever, that looks like for them. Same with instruments. We see it all the time with instruments as well. Sets that come back and they're not opened at all. What's the need for it? Is it an answer of, well, it was on the preference card and we never changed it, we need to change it off the preference card, solution solved? Or is it, well, we might run into something and we need this retractor that's in that set? And then start digging deeper. Okay, well, do we need to add that retractor to the set that you guys do use? Is it something that we want to pill pack, or do you actually even need the whole set altogether? Those are the kind of questions and stuff that's important, no matter if you're doing, easy scopes at an ASC, or if you're doing, big inpatient complicated surgeries, at an academic center.
Yeah, that's all really great advice. At our facility, the way that we at least started to answer some of those questions was created a special scan on our tracking system, not just back to storage, but this is a return from sterile from the OR back to storage, so that monthly we had that list and could work on slowly all the very difficult questions to answer that you just described, like what's consistently coming back, and then doing some of the investigative work to figure out, okay, why is it coming back so consistently, and then solving some of those whys. And it does buy your team time back eventually, but it sometimes takes a while to get to the bottom of it.
It does. And I always recommend, like, it's the same. I know we talked a lot about preference cards, but it's the same with instrumentation as well, right? Which is, technology is consistently updating and changing. And so if you have a set, and I'll give an example of myself. When I was still at the bedside, when I was scrubbing, orthopedics was my main service line. And when I first started scrubbing, we had this huge, large bone set, and it had, all the point to points and reduction forceps and bone hooks and things like that. And then, but as technology kind of transitioned and grew and got better, the vendors would sometimes put these in their sets, or the instruments just kind of became unnecessary, obsolete with how their technology and their systems had changed. And so we had, at one point we're like, why are we, this set is number one heavy. Why are we opening this up, every single time? And so we took it, got with the surgeons and said, hey, what is it that we really need in here? We, removed half of that stuff, half the instruments in that set, So I always recommend, not only with preference cards and supplies, but with sets too, to always, go back and touch and reevaluate if the stuff is actually clinically necessary, or if, stuff can be kind of purged out of there.
There's a lot of great points made in this, where to work on. I really like when Bobby bringing up like that scan point. We've also utilized that at our facility as well. And some of those ideas really do maybe get some of the audience thinking about what they can do to make it a little bit better. As we're wrapping up, what advice would you give for a department where to get started on making some serious progress with their preference cards or even their case cart pulling?
I would say, number one, going back to making sure you have the right key stakeholders and engagement in your teams, and then create that charter and that goal that you're looking for. That way, you know what people are working towards. You can PI the individual processes within those to reach those goals. And then you know what you should be working towards looking at and then reporting out about it. I also think it's important, if to try something, if it doesn't work, take a step back, reassess, but don't drop it. Don't give up on it, right? Keep working through it, whether it's good or not. And I tend to find, like, even the small things, if you report out and you show people the improvements and that you're trying, then that becomes addictive, right? And then it just kind of, it's like, a snowball effect. It just gets bigger as it's rolling down that hill. And so I feel like that's just that big portion of that. And then, like I said, once you do it and you complete it, you're not done. You're going to continue to keep on. Don't let that project drop off. It's like cleaning your house. When I mop my floors once, I'm not done. I have to go back and I have to continue to do it again. And it's the same with both case cards and preference cards. Don't let it fall off. Create a good way to do continued maintenance and continue to PI those processes so that you can continue to make it better.
Absolutely.
That's some great advice, not only for case cards, but just PI in general. Have a goal, measure it, get folks excited about the process, stick with your changes, keep working at it. If it doesn't work, like, that's the bread and butter of making a department better. So I appreciate that advice. Really good interview today, Courtney. There's obviously a lot more that we could talk to in particulars about how to make case carts work, but this certainly has painted a picture, at least as a path forward for folks who are trying to make improvements. If somebody wanted to ask you more about this topic, what would be the best way for them to get in touch with you?
Yeah, absolutely. They can reach out to us. We are on the HealthTrust website under advisory services, and there's a link that they can click that will email us and do that. Or Bobby, I'm sure they can reach out to you and be like, yes, I know these great people, and I will connect you with them, right?
Yeah,
Bobby,
yeah.
Yeah, our friends. Yeah,
a little bit of free advertising on Beyond Clean today, but yeah, we can get you connected on LinkedIn as well. Courtney, really great conversation. Thanks for sharing your insights with us today.
Thank you. It's been great. I'd love to do anytime you want to do something else, let me know.
That was Courtney Kleeb, Senior Director of Perioperative Surgical Solutions at HealthTrust. And man, Angela, what a practical, helpful episode. One of the things that I thought was really interesting about it is how interconnected all of the episodes of this season are. Certainly because we're doing a topic, they're all going to relate to one another. But when you talk tray logistics, like, it's a big pile of spaghetti, like it's all interwoven together. I'm thinking particularly around that example that she gave of your sterile returns in your case cart system might be impacted by your OR not having their inventory locations at arm's reach. Like when we talked to Melanie about substeriles and how making smart decisions about how you're going to move trays around and where you're going to store things impacts everything all the way down the line, from emergency carts like we talked about with David to even case carts as we're talking this week. So really interesting stuff.
Yes, spaghetti is definitely something that was standing out in my mind because we discussed spaghetti diagrams a lot and how much you're moving around and where you're going, like, going from one part of like a row of instrumentation all the way over maybe to soft goods and things like that. So yes, I keep in mind of all of those extra steps where we love exercise, right? But we really want it to be efficient. And then that way you can do like the upwards to 40 case cart pulling that you're doing within a certain time frame. So absolutely took away some really good points from this conversation.
Yep. All the spaghetti from today. Well, it is a good point. If this was an hour show, I wanted to dive further into that labor conversation and talk about, how that's calculated, how that's measured, like how do you look at an efficient process? And then from a labor perspective, how do you put a number for soft savings on that? Courtney obviously is not going to give us a flat answer of if you do these things, you'll save $1 million every year. But I mean, I have talked with their team about facilities that they've calculated a soft savings of well over $1 million over the course of a year, just by, changing what they're purchasing, changing the efficiency with how they're picking things, taking things off that they don't need to have, just by diving deep into the case cart process. So tremendous opportunity there for sure.
Absolutely. And cost savings as well when you have maybe newer staff in the OR opening things that they shouldn't, and when you have to charge it out once it's opened.
That doesn't happen.
Yeah. Everyone does exactly what they need to do, right?
Yeah. I'm well familiar. So I hope this episode has been as interesting and helpful for you all. If you have something that you'd like to add, a hack, a tip, a trick that has really transformed your case cart process, and you'd like to share that with the industry, reach out to us, info@beyondclean.net. We'll take a look at that and, maybe do a blog article or another follow-up podcast episode on this topic, because there's certainly a lot of facility-specific considerations. There's not one model that works, but as Courtney showed us, there certainly are some principles that can be applied to make it work well. Well, that's going to do it for today's episode of the Beyond Clean podcast. It was good talking with you again this week. And until we see you again next week, on behalf of Angela, myself, and the whole team over at Beyond Clean, keep fighting dirty.
Thank you for listening to this week's episode of Beyond Clean. As a reminder, you can help support us by subscribing to Beyond Clean on your favorite podcast app, or by downloading the smartphone app on iPhone or Android. Simply search for Beyond Clean in the App Store or Google Play. The best thing about downloading the smartphone app is that you can access bonus content for certain episodes and view episodes in certain categories, like articles on the go and vendor spotlights. Are you following us on LinkedIn or Facebook yet? If you are and you love an episode or post, then let your social network know about it. Like, comment, or share our posts along with your thoughts and keep the conversation going. If you have any topics or guests that you would like to recommend for a future episode, just send us an email to info@beyondclean.net. We look forward to hearing from you.